A liquid biopsy refers to the collection and analysis of blood or other bodily fluids and can help answer key questions about cancer. Liquid biopsies primarily involve the capture and analysis of cell-free DNA shed by tumors or circulating tumor cells.
So I've been in the cancer research space for several decades now, and over the last decade have really been excited by the possibilities of liquid biopsies and cell-free DNA technology. It's clear that the technology is now making tremendous inroads in identifying the right therapy for the right patients. It's already doing that, and in the near future, it's going to be utilized for monitoring patients and understanding their response to therapy, and then ultimately looking at earlier stage disease, whether there's recurrence in an early stage patients, and I think even later on for early detection and screening. It's been thought that a simple blood test where one could collect a blood sample, one could have it analyzed and identify abnormalities in the blood could be a very simple and non-invasive way and with much higher adherence to detect individuals with cancer. In addition to the cancers for which there are screening methodologies, but for where we really could benefit from a regular non-invasive approach, there are of course many other cancers for which screening technologies just don't exist. Now, it should be mentioned that additional studies need to be done to really fully evaluate the benefit of early detection and intervention in these cancers for which no screening approaches exist. And the question here is, typically after surgical resection, does the patient still have localized disease? Does he or she still have what's called residual disease that hasn't been fully removed by the surgery? And the question is whether additional therapy at that time point could help the patient. For example, currently for stage 2 colon cancers, the optimal therapy is just surgery, but we know a subset of those patients recur. We'd love to give them adjuvant therapy, but we just don't know who to give. And so if we had a test that after surgical resection evaluated whether patients still have residual disease, we could identify that subset that could benefit from that additional therapy. I think the area of using liquid biopsies for therapeutic selection is already a reality. We have a number of different labs providing these kinds of tests in a regulated manner. It can be hard to actually determine by looking through imaging analyses, CT scans, other imaging analyses, whether an individual has actually benefited from their therapy. And so we have begun to evaluate whether liquid biopsies are a surrogate for response to therapy, whether the level of mutations in the blood can drop if you're responding to therapy, whether the levels continue to rise if you're not responding to therapy. And it's these kinds of analyses that can give you information as to whether the patient is a molecular responder or a molecular non-responder. And this kind of molecular response information turns out to be actually apparently more informative and probably faster than imaging response information. Now, there's trials that need to be performed to fully work this out. When patients progress, it's obviously helpful to understand what the multitude of changes are within an individual cancer in order to decide what therapy to use next. Using liquid biopsies, one can evaluate the blood. The blood, of course, is collecting pieces of DNA from different tumor sites in the body. And this then allows you to say, well, what are the changes that have occurred in this individual tumor? And can we use that to guide a change in therapy? I think with any new technology, you obviously need a forum to discuss these and their applications for healthcare. And really, AACR is probably the premier organization in the world to be hosting discussions about liquid biopsies, their underlying characteristics and technologies, and then their applications for cancer patients.